Welcome to Perspectives in Peds, or PIP for short, your go-to podcast for insights into paediatric practice. From clinical approaches and emerging research to the everyday wins and challenges, we bring you OT perspectives that inform, inspire, and spark conversation.
Hey everyone, welcome back to Pipcast.
Hello.
Today I'm joined by Mikayla and Georgia, and we are going to have a chat about DCD, or Developmental Coordination Disorder. So Georgia recently did a PD and we see a lot of kids diagnosed and not. So we thought we would dive into a bit of a chat about it and hopefully give some tips and things to think about that we may not have thought about before. So I guess to kick it off, the first thing we want to know is why, I guess, we decided to do an episode on this, because we feel that DCD doesn't get enough airtime, I suppose. Why is that?
I think there are so many domains in which DCD impacts a person. And it's my experience that like a family might come in with presentations and challenges in one kind of living domain, and there are challenges across other domains as well. But they don't put all those pieces together into one, and you kind of need to consider quite a broad range of things in order to recognise the DCD diagnosis or dyspraxia diagnosis. So I think it gets missed because we're only looking in one place and not looking everywhere in one go.
What do we know about the stats in terms of prevalence of DCD at the moment?
There's some research out that says it's prevalent in roughly like 5 to 6% of children. There's a high co-occurrence rate with ADHD in particular. I think the stat is 1 in 2.
Wow.
People who have ADHD are also dyspraxic or have DCD.
Wow.
There you go. I mean, I don't remember covering that at uni. I don't remember what it's like at the moment. Peds was minimal anyway, I acknowledge that. But I guess that's also something, it's not always front of our mind to think about or consider. Would you say it's largely undiagnosed then, or misdiagnosed?
Yeah. I would say so. And I'd also say a lot of people don't know what DCD is. Like sometimes I'll mention to a family and say, have you ever heard of DCD? And they say no. So I guess of like knowing what to look for and knowing that it could actually not just be that your child's clumsy and there's a little bit more to it. I think that's where it can also get missed and then I guess be underdiagnosed.
So if we sort of explore a bit of a definition or explore some of the diagnostic criteria of DCD, where do we sit with that?
Well, I can tell you what some of the criteria is. So I've actually got it in front of me because I want to be specific here. So there's 4 criteria that you have to meet to get a diagnosis as per the DSM-5. Is that correct? Yes. So the first criteria is that the acquisition and execution of coordinated motor skills are substantially below expected levels for the person's chronological age. So this can show up as clumsiness, slowness, inaccuracy in tasks like handwriting, using scissors, tying shoes or playing sports. So that's 1. B, so Georgia.
B is looking at motor difficulties significantly and persistently interfering with daily activities. For example, self-care, academic achievement, or vocational and leisure activities, which is really important to us. Yes, in a nutshell, that one is daily activities are really hard, consistently and for a prolonged period of time.
Third, so criteria C, there's the onset of these symptoms begin in the early developmental period. And criteria D is that they're not better explained by intellectual disability, vision impairment, or other neurological conditions like cerebral palsy.
So you do need to meet all 4 of those criteria in order to receive a diagnosis of DCD.
So you can't just be clumsy.
No, you can't. But that is often probably one of the key presenting challenges that a lot of, pediatricians might explore or parents might present with their children.
I know back when I first started as an OT, I guess it was dyspraxia then, and the peds just wanted us to do a motor skills assessment and almost show that they were below the 7th percentile at that time to sort of – that was like their threshold to sort of explore that type of thing and eliminate other things. Is that still the case? Is that kind of what peds are expecting?
I think that they're having a standardized motor assessment is definitely the preference, and that can be the BOT, the movement ABC. We can also combine that with like Vineland scores as well, so functional participation assessments.
Yeah, so linking with that, I think it's the second criteria where it actually does show that it links into having
Impacting.
Yep.
Yeah, but it is it's not my understanding that a score equates to a diagnosis super rigidly. I think we need
I'd have
a
to
bit
look
more. We need more
into
information than that.
Yeah. I guess that also flows into this idea that kids with DCD are just clumsy or struggle to ride a bike without training wheels, but we know that things like academic performance and other motor skills and even social things can be impacted. Can we talk a little bit more about where we see it impact across daily activities?
Yeah.
I often see the kids that I've worked with that have DCD or suspected DCD take a really, I don't want to say a really long time or a longer period of time than perhaps expected to learn a new motor skill, which can really give a hit to the confidence for these kids where it ends up being like they just don't want to try. So that's where I think I see it a lot, or things like wiping even when they were learning toileting needed so much repetition and practice, even though they were doing the same thing every day to then actually like master the skill. And that doesn't mean that they can't master it because they can do it now, but the time that it took to learn that, similar to like riding a bike or handwriting, was like that would be really hard to do something that many times and not see success.
I think we underestimate the psychological impact of that across the lifespan too. And when we see these kids who are masking their challenges through avoidant behaviour or really not engaging with certain activities, I think we really need to deeply appreciate why that is occurring, because it must be incredibly difficult for these kids who have taken so much longer and more effort, and the fatigue they experience learning these new skills is very, very intense.
Yeah, like in terms of like using like a growth mindset, if I was using a growth mindset for something that I just wasn't seeing success with continually, that would be very challenging and I would avoid it.
Yeah, I think there's a lot of research out on the social implications for kids. If you think about a kinder or early childhood age child who can't keep up with their peers on the playground, they can't climb up the side of the playground, so they can't keep up in chasey, and they can't kick the ball back when people pass it to them, or it takes a really long time. Has had really adverse effects on children's self-esteem, their social participation, their ability to form relationships. And children become very acutely aware very early whether they are succeeding at tasks, particularly academic tasks and social tasks, compared to their peers.
Yeah.
So there are some really, really significant impacts on their self-esteem, and that then it becomes chicken and the egg, because that then causes them to withdraw from trying new things because they have that lower, lower esteem to try new things, and then the reduced rehearsal when they already are people who are going to need more rehearsal to learn a skill kind of perpetuates, which is really, really tough for them.
Also makes it harder to assess.
Yeah.
Because those kids, they often don't want to engage in the assessment. So to get the figures and numbers that we need can be incredibly challenging. I know both of you have recently done some BOT assessments with kids, and sometimes it spans multiple sessions just to actually complete them, because there's so much resistance to engaging in those activities they know are difficult.
Yes, I literally heard 2 days ago it was like, I can't do it. I can't do it. And we were like, why do you think that? And they were like, I just can't. And then when they tried, they actually could do part of the task, and they were so surprised. They were like, oh, like I can do some of it, but it was like, I don't want to try because I probably might not be able to do it, which isn't a good feeling.
Which really highlights the complexities of providing therapy with these kids. It's not just about repetition and practice and getting them to do it. It's all encompassing in terms of managing those expectations and building confidence and working with the child and the family, and understanding that there's far more supports than just the skill development that needs to be put in place.
Yeah.
In terms of myths, what are some myths that we've come across when it comes to DCD?
That it's just handwriting that is affected by DCD, and it's just messy writing, and it's actually not that bad. It doesn't affect them that much,
I would agree with you, Georgia.
which really grinds my gears. But all myths do.
That is true. I think one thing is that they can't show like skills in certain areas.
yeah.
So a lot of these kids, it's like they can't have DCD because they're really good at cricket.
Yeah.
And
Yep.
they've actually that's maybe something they're really interested in. They've actually worked incredibly hard to build those skills and have exposure to the repetition that actually allows them to be really good at that thing. So I've had kids that, are really good BMX riders that still have DCD. So I think that's a myth that we need to think about. If your only questions are quite narrow around specific skills, you might be missing something. So I think that that's an important one. Any other myths from your perspective, Mick?
Maybe in terms of like just the practice side of it, that like just heaps of practice perhaps will, I guess, like help. Like I think it's going to be specific and targeted to what the end goal is. And there's definitely like certain strategies like co-op that have been shown to have, I guess, really good success within like children with DCD. So I think it's just, almost like trial and error sometimes isn't always the strategy that works best.
Got a bit of a more controversial one. We get this requested a lot in terms of doing PDs and topics on, but just integrate their reflexes.
Oh, yeah.
Oh,
Yeah, you see a
give
lot
me
about that. I think it's a bit of a
break.
hype at the moment.
Honestly, that's just another myth as well. They just didn't integrate their reflexes and that's why they've got challenges. I think that really undermines the nature of a DSM.
Diagnosed disability.
Yes,
Yes.
that's right. So I think that we've got to be really careful that it's like they didn't have enough exposure, their parents didn't take them to the park enough. All of those kinds of things can really not just add to the challenges the child experiences, but also put a lot of responsibility on the parents that they potentially miss something in terms of motor skills. The child didn't crawl, and we know that that can have implications,
Yep.
but the family feels that they had something to do with that they didn't provide enough exposure, rather than the child was born with a neurodevelopmental condition that has made those things incredibly challenging from the get-go.
Yeah, and it's like maybe that child bum shuffled or didn't crawl because they
Yes.
had DCD.
Yeah.
Like, perhaps.
Just
Just
hypothesizing.
maybe. Just maybe.
Oh, there's so many chicken or the egg questions around this, isn't it? So
yeah.
I guess when we're talking about function over the test score, what do we see? We spoke a little bit about the Vineland, but what are some of those challenges across the day that maybe aren't the obvious ones that we might think about in terms of where DCD can show up?
Interestingly, and I learned this through my recent PD, was a lot of executive dysfunction or executive functioning difficulties. The way that DCD manifests is difficulty with our processing and our planning and the way that our brain signals our body. And that also shows up in our executive functioning skills and challenges there. So I think that's like an unexpected thing that a lot of clinicians aren't necessarily looking out for or kind of correlating with DCD. So that can be one.
I guess like building on that then, thinking about all the things you do in your day where you require executive functioning, I think it's everything.
Yeah.
Yeah.
So like self-care, organising, getting ready for school, organising your belongings in the classrooms, like are those some of the things that you would expect to see with a child with DCD?
Completely. And I think it's those ordinary tasks taking longer than expected despite a child being focused on them or working on them. It's not, they're getting distracted, so they're not getting dressed in one go. It's like they're actually getting dressed the whole time and it still is taking 20 minutes to do because it's that much effort to work out which foot to put in which leg hole or whatever.
Is that where you would almost see like children where they come in and the family's like they can get dressed, like they can do it, but they always want me to help? Like, is that something that you would see?
Yeah, completely.
Yeah.
And I think off the back of what you both just said, there's so much fatigue for these kids.
Oh, completely.
So that it's just exhausting putting in the effort that they have to put in for all of their activities of daily living. So often those kids are presenting with quite low affect, and they are quite sometimes demotivated to engage in things, and can come across like you're like, come on, like they just need a little cheerleader, but you can understand why they are difficult to get started. And it's not just the executive functioning, it's like they're dealing with that and the effort to activate the motor plan as well, and just get the muscles going is very challenging.
And asking a child to articulate that, like that's really tricky because you might say like, what's up with that? And they might say, I don't know, when maybe they actually like don't know, because that's a really tricky thing to have self-awareness around in terms of that it's actually exhausting or just tiring, but can't like pinpoint your finger on like what exactly it is.
And because it globally affects all kind of activities of daily living, it is really hard for a child to recognize that it takes them extra repetitions, or takes longer, or is more challenging for them, because they don't have the lived experience of the alternative. We as the observers are able to see that their development might look different to one of their peers. They don't have that lived experience of knowing it feels different to other people, and they definitely don't have the vocabulary for that if they are younger, until we kind of give it to them as well. I guess other functional areas that we see a lot, I don't know, I was talking to the social point before, but socially in play and in sports and in PE classes, it, really impacts participation. Again, the fatigue is a really big one, but just generally just doing the tasks that all the other kids seem to be working out, and they're just like, I can't keep up, I can't keep up.
Hard.
It's really, really tough.
Yeah. I think it's more recently come on our radar a little bit because of the changes to the DSM in regards to SLDs and particularly dysgraphia. And I think those messy handwriters, we've just recently done an episode on SLDs. So I think it's important to note that there's no motor component listed in the DSM when it comes to dysgraphia.
Yep.
So we've really started shifting towards, which I actually understand, and I think it's a good shift, is understanding when kids are having difficulty with handwriting, we need to be looking at motor skills and potentially ruling out DCD, because the dysgraphia part is the cognitive, the producing of words and being able to actually form sentences, whereas if there is a motor component, it could be attributed to DCD. And is there any other reasons why we think previously and continues to be the case that DCD is missed or not diagnosed?
I think awareness of what like DCD actually is. And I also think a lot of activities that DCD impacts, for example, like handwriting, if we haven't assessed the whole picture, it could look like strength or pencil grasp, and then the intervention's focused on that rather than like using a global like problem solving approach. So I think sometimes the intervention might be quite isolated and not being able to be transferred to different activities, which I think just makes it a little bit tricky in terms of, maybe they did make progress with handwriting because they worked on that, but then it's like that worked. It's a little bit tricky in terms of awareness and intervention, I think.
Gets complicated with differential diagnoses, I think.
That's what I was looking for.
I feel that a lot of it is, maybe it's because of the executive functioning challenges that we jump to ADHD, and given the co-occurrence, do you think that has something to do with why it's missed?
Yeah, definitely. I think because there is like a low, I guess, community awareness as well, there's not heaps of parents who would be super informed before they've gone and explored diagnostic assessment for their children. If they present to a psychologist, for example, who with concerns about executive functioning, and they don't know to report the additional motor challenges that the child is having, a psychology assessment, to my understanding, doesn't traditionally include some of those motor components and more functional components when they're assessing executive functioning and cognition. And so it's really common for kids with DCD who may also have ADHD or may just have DCD to go through assessment through a psychologist for their executive functioning challenges and not be diagnosed with DCD because they haven't had their whole functional participation explored
With all
or
of that
assessed.
in mind, how do you guys then screen for DCD when you think that could be something potentially happening for one of your clients?
Yeah, I think DCDQ, which is the DCD questionnaire, a parent reporting questionnaire where they mark how often they see certain behaviours in their child,
Yep.
is something that I have started doing alongside motor assessments. I do motor assessments.
Yeah.
Particularly we like to use the bot 3 now that we've
Yep.
just started using here. Formerly the bot 2.
Yeah.
And the Peabody for younger kids as well.
Good one.
There really does have to be a multidis approach, doesn't there?
Yeah.
Like if we're truly providing, I guess, a holistic profile of the child and what the challenges are that they're experiencing, we've got to eliminate language disorders with the speech, and we do need to contribute our part in terms of motor skills, and the psychologists do need to do the cognitive testing, and we each bring a specific kind of expertise to the party, but we just need to be aware of those components as well and really do our best to inform the diagnosing pediatrician or psychiatrist who is exploring these things, and it just really highlights why things can get missed.
Yeah, because it's like when a motor skill's delayed versus when does it become DCD? Like I think that has to be considered when we screen and assess for it as well, and that's going to depend on age and their environment and so many different things, but just shows it's probably not as simple as just doing a motor skills assessment. Like you said, there's so many things that actually have to go into it.
Mm-hmm.
So once we identify that the child has DCD and they have that diagnosis, or even if we're suspecting that, where do we go with actually supporting and providing treatment in that area? What does best practice look like? What are the approaches? What's the PD you did, G?
I think it was just called Understanding DCD Dyspraxia.
Okay, cool.
It was from Dr. Anya O'Day.
Okay.
And I did it through ZMA, but it was really like foundational knowledge about assessment, intervention, and just like what DCD is. as well.
Great.
And so many things that you've even already told me off mic. I've been like, wow, I didn't realize like that was something to look for and screen for when looking at DCD. I've recently started the co-op PD.
Yeah, I've done the co-op as well. It's really good. And a lot of
anyone
the
listening?
evidence for it is in relation to DCD populations.
And that
So-
was
Yep.
strongly recommended
Right.
by who I'm now a huge fan of, Dr. Anya.
Yeah.
Who woke up at like 3 a.m. in Ireland time to present to us at 4 p.m.
Wow.
Melbourne time, which was really cool. But she spoke to a lot of evidence around using the co-op as a way to have like, I guess, an evidence-informed treatment plan. Similarly, there was studies that she spoke about where they compared doing functional tasks for motor planning, skill development. For example, a child's really motivated to get onto the basketball courts, having your exercises be actual basketball drills, for example, rather than having more generalized exercises to develop strength and coordination and dribbling, actually had like significantly better results. So if we are, I guess it's really OT bread and butter, but using your functional skills and having really functional and clear goals,
That
we'll
are
see a lot more
meaningful.
meaningful. We'll have a lot more progress for a child who has DCD than if we kind of more generally go, let's develop their core strength overall.
Yeah.
It still had pretty good evidence, but it was better if we said core strength in relation to dribbling a basketball, and we're going to do this by dribbling a basketball.
Co-op also adopts the same, I guess, thinking around it should be top down. And if there's motivation there and it is the child's goal, like we saw videos of a child learning to ride a bike in a few hours and some of them, I think one dystonia was someone's like part of their diagnostic profile, and they could ride a bike a few hours later just from using the co-op approach. I think a misconception around the co-op approach that I had was that it should be all like child-led, like don't prompt them as much and they should almost figure it out themselves, which is actually not the case, which I was really surprised about. And there's lots of different types of strategies that they suggest that you coach and prompt, and depending on where they are on their learning journey, from cognitive approaches to task-specific strategies to motor skill, self-scripting and those sort of things. So I think, where to go? Co-op.
So we're very pro top down, I think.
Yeah, I think for this,
in this context for sure.
Yeah.
Yeah.
So I guess beyond our therapy room or when we're visiting kids in school or the home, how do we set these kids up for success? In addition to our therapeutic approaches, what else needs to be considered or put in place?
I think whatever you do must be collaborative with the child so that they know what supports are in place so they can transfer that eventually to other places. That's what I would say.
Yeah, I like that. I think considering the breadth of like challenge that they might be having with a task, particularly I'm thinking about in the school environment, knowing that someone who is having trouble with their motor planning might actually have a really hard time keeping their body upright on the floor for mat time. Considering all of the things that are challenging in their day and picking a couple of things that are the priorities for us to be challenging and working on, and then accommodating their needs for the other things, letting them sit on a chair up the back and things like that so they don't become so tired that by the time they get to their desk to do their writing task, they've got not much power left in their muscles, for example. So I think it's that real managing and mitigating needs and pushing challenges in some areas and just relieving demands in others to make sure we're considering their capacity as a whole.
That just highlights how important the collaboration piece is. Like there's a space for capacity building through child motivated goals and co-op and really working with them, but balancing that with environmental and activity adaptations and accommodations because we know they need it. I think that's a really important point. I think also just giving families the language to actually advocate for their child in the school so they understand it and then they can be their child's voice as their child is learning to self-advocate because they're also a team as well. And I think that those kids, like you said, when they're young, they don't have the words, they don't have the understanding. They're in their little body that they know. They don't know they're experiencing more fatigue than other kids. And that's where that confidence kind of can get really smashed. Like you said before, G, they're seeing the other kids having success and doing things well and they're like, there's something wrong with me that I can't do this, rather than building that understanding of you're actually doing an amazing job because this requires so much more effort for you. And I think that can be really empowering for kids to understand and learn, and parents are a huge part of that. Should we finish with some quick fires?
Always.
All right. What is a word or label that should just be put in the bin when it comes to DCD?
Lazy.
Unmotivated.
I was going to say careless.
Yeah.
Yeah. Put them in the bin. Let's not talk about those words with these kids anymore, and help families who I guess feel that as well and can report that, how we can reframe it. There's so much power in us supporting families to truly understand their kids' challenges. One everyday task that tells you more than any standardized test.
I think swimming is like a big one.
Oh, coming from the swimmer.
I'll take it. I think swimming is like I ask about swimming and it can tell me a lot.
I love that. There's so much in that because there's all of the like listening instructions in a small group in a loud environment. There's like so much motor planning. There are relative age expected like kind of levels.
Yeah, you actually progress through the levels. Yep.
Oh, I love that.
What's yours?
Oh, I don't know now. That was such a good one.
A good one.
Oh, you stole my thunder. I'd say something a bit more day to day would be like getting dressed. Something that we often will do we do it 2 to 3 times a day, we would expect someone's well rehearsed at it. And if they're finding that tricky consistently, that will be really important to understand.
And I think further to that, all the steps of it, like some of those kids have success with the rote learnt element of it, but if their clothes aren't out for them in the morning, laid in order, suddenly it all falls apart. I was going to say cutlery use.
Yeah,
I think
that's a
that's
good one.
something that the kids, again, I think that gets labelled as lazy because they use their fingers or they just want a spoon. But when it comes to the point where they have to learn to use a knife and fork, things kind of fall apart. Buttering toast, those kinds of
Like
things.
ripping it with their knife and fork.
Yeah.
Instead of like cutting.
Yeah, there's none of that's in a standardized test, and that can really highlight some challenges. The most underrated 5-minute strategy you'd give any teacher.
Goal plan, do check.
Oh, man, I wish I got in
So
first.
quick. What is this, a race? Oh gosh, 5-minute strategy. I think it'd be something to do with rest breaks, and it'd be about utilizing a rest break effectively for a child, not
That's actually really
so that
underrated.
it actually
Yeah,
benefits
that's
the
true.
child and gives them the break that they need to be able to recharge.
I was going to say like scripting, but it kind of comes under goal plan, do check, but I'll piggyback off that. Finish the sentence. The kid everyone calls lazy is actually
Ooh, yikes.
Having a hard time.
Yeah.
resilient.
Trying their best.
Love that. Thanks for joining us on Pipcast, Mick and Georgia. We'll put some of the things that we spoke about in the show notes, some of those PDs and the DCDQ and those kinds of things. But thanks for joining us, and we'll see you next time.
Thank you.
Bye.
Bye.
Before we go, if you are a clinician looking for more support between episodes, KidLink has a range of services designed to build your clinical knowledge and confidence. KidLink Education is home to our on-demand, high-quality professional learning you can apply straight away into your practice. If you want access to monthly PD, group supervision, and our community of like-minded OTs to learn from and connect with, check out OT-Link. We also offer clinical supervision, which is designed to support your growth across professional, clinical, organisational, and personal goals, wherever you are in your career. If you enjoyed this episode, please hit like, subscribe, and follow. It genuinely helps more clinicians find the show, which means a bigger community and more of us doing what we love. Thanks for listening.